illnesses. So today we are going to look at signs and symptoms. So some of the signs we are going to talk about, of course, signs are the observable features, the things you see, and symptoms are things that you may not clearly see, but maybe you're feeling. So we shall focus on breast cancer in women, and there are a number of signs that we are going to talk about. One is that when your breast as a woman is painful, that can be a sign, but I am not saying it is a sign to confirm, but it can be a sign to warn you that something has to be done. Two is the tenderness. Tenderness means that when you press around that breast, that where you're feeling maybe some pain, it is painful on touch. When you try to press your fingers around that area, it is painful on touch. Three is that breast that is suspected of having breast cancer, its nipple, when you press it inward, when you press the nipple, it goes inwards. The other sign that we can talk about is that when someone has breast cancer, usually the breast feels warm or hot because there is an inflammation going on inside. So there is that kind of temperature that is higher than normal or than the surrounding. The other thing is, and one of the most important signs is the mass. There is a mass. When I say mass or a lump, I mean something hard within that breast where it is suspected to have cancer. The other sign that we can talk about is the discharge. Like when you try to press that breast, it is producing some kind of fluid. And this fluid is not breast milk, but sometimes it can be watery, something like water that comes out of it, either when you're pressing it or sometimes voluntarily you see it leaking out. The other sign that we can talk about as a sign of breast cancer is, a human breast is made in a way that yes, it has that softness. It has that softness, but and it has that color which we normally see, the normal color of a breast. Of course, the colors may change depending on the color tone of the person. But if there is discoloration, in other words, if that breast's color is not the normal one, either it is darkening, in most cases when it darkens than the surrounding area or in comparison to the other breast, that can be a sign. The other sign that we can look at as a sign of breast cancer is the swelling, because yes, when this breast is suspected to have breast cancer, usually it's much bigger than the other one in comparison when you compare the sizes. So that can be another sign that we can look at. Sometimes the breast may get sore as if it has some rash or some small wounds, especially around the nipple area. That can be another sign that can show you that actually something is not right. In our bodies we have something called the lymph nodes. Lymph nodes are points within our bodies which trap infections when the body has infections. But in this case, when the lymph nodes, especially around the armpits, when you feel some pain around the armpits and when you try to touch inside, there are some small kind of swellings that you're feeling. It means that the lymph nodes within that area are trying to trap or to respond to an infection or to a foreign body. So that can be another sign to tell you that something is not right. So there are a number of things that we can talk about, but once you see any of those signs, I would suggest that you clearly go and be examined. Thank you so much.